Hi guys. Okay, so this video is about tips on how to be successful on your nursing exams. This is what I do, and it has never failed me yet. What's happening? Okay, first I want to tell you that in nursing school you make a lot of friends and a lot of sharing and caring going on within certain groups, because you know everybody is clicked to death in nursing school, right? My advice to you when it comes to sharing your notes is like if you receive notes from people, listen, I got this from the last semester group, or I got this from such and such, and these are the notes from the blueprint or the study guide of what you need to study. Be careful with floating notes. I call them floating notes. They're floating around everywhere. Be careful with them. I really don't depend on them when it comes to studying. I look them over, but that's not my main study source. Do not make floating notes your main study source, because it will disappoint you, especially if you don't pass the test, and then you're going to look and be like, I studied from this. Don't trust it. Trust your own notes that you spent time on taking and working through. What has helped me with my nursing exams, and this is why I'm getting like high 80s, 87s, and 90s and things like that, is because for me to retain information, I have to work through the information. So I need to read the book. I don't have to read every word, but I need to read the book. You hear some people say, well, I don't read the book. They do whatever. No, I need to read the book, because your nursing exams are not coming from, little random places. It's coming from the book, and you can pick out questions and see where the questions are in the book that you will be asked on your test. They're going to be concepts and examples of situations and things like that. Those are your test questions. So I read the book. I make my own notes, because when I write and make my own notes, I retain the information, and I just go back and study what I wrote. And there's a lot of hidden information when you read. You'll find little bits of certain things like, oh, I didn't know that. And then that can help you, because you can apply it to other disease processes, because they're linked, and they'll help you get a deeper understanding of something that you probably didn't really understand pertaining to another disease process. So you are building on top of your learning, and it has helped me tremendously. Another thing is, when you're studying, you have to really be organized. Don't have everything scattered everywhere, because you'll forget that, oh, I have put information over here in this book or on this PowerPoint or document. And when you're studying, especially if you have a short time between that time and your test, you won't forget that, oh, this information right here is important and I need to study it. Everything is together. So organization with your study, it has to be together and on point, so that you can compartmentalize all the information and nothing will be all scattered. It depends on how your brain works. Me, I have to put everything into compartments. If it's not in the compartment, it'll kind of throw me off, because especially with signs and symptoms, it needs to be in a certain compartment so that I can identify it with a specific disease process. And you know that most disease processes, they're linked together, but in my mind, I need to know, why is this happening? And that's another thing. When you are studying signs and symptoms, if you understand why it's affecting the respiratory system, why it's affecting the urinary system and the kidneys and why it's affecting this and that, then you don't have to really study the 3,000 signs and symptoms that comes with the disease process, because you understand how it's affecting each body system. Once you understand that signs and symptoms, you'll be able to name them right off the bat. So understanding the patho of a disease is very important, because once you get a good grip on that, the signs and symptoms will come, because you begin to understand, okay, that's why this is happening. So you don't have to really do a whole lot of studying. You want to maximize your study time. You want to study smart, not hard. You don't want to stress yourself out in studying. So no floating notes. Take your own notes. You want to give yourself enough time to study. Do not cram. Do not cram, because that is how your information becomes all mixed up. Especially if you have a photogenic memory like I do, you'll see a word or you'll see a symptom, and then you're like, oh, I recognize that. But it doesn't go with that disease process. It doesn't go with that condition. You just see it because you recognized it. You see it on the sheet, you see it, and you say, oh, that it's in the answer option, so that must be it. 9 times out of 10, that's not it. Especially if you don't know the information. You can get a lot of knowledge-based questions correct on your test if you just read the book. Read the book. You don't have to read it word for word, but you need to go through each and every one of them, especially if your teacher is harping on a certain thing. You need to go back and you need to read that word for word. As I'm progressing through my nursing program, I don't find answering questions as hard as I used to, because of the study techniques that I have learned and the different methods to answering questions and how to rule out certain things. Let me give you an example. My first maternal child test was yesterday. I studied, okay? I studied, and I answered questions from every source that I have. Did the ATI, did the Saunders, solidified my understanding by reading over again the information, and I studied. When I got that test, I felt so defeated, because it was very challenging. It was like, I know this information. Now, the difficult part of nursing school is really not the information, is applying everything to a situation, because you have to now pull from all of these resources in your brain and all the knowledge that you have. You have to begin to pull it, and you have to begin to analyze and put it all together. That's the hardest thing to do, because your brain is used to working fact-based. Okay, this is it, that's the answer, and that's just the point blank and the period answer. In nursing school, that is not the answer. It's multiple answers, but it's the best one. And the priority questions, it's like, what I've learned is which one, if you don't do first, will not allow you to do the others, or will kill your patient, or will make the others not make any sense, or things like that. It's different degrees, because with priority questions, it's like, okay, you have to do this first before you can do that anyway. That's how you rule out priority questions. But as you go and as you answer questions and study the rationales to why you got it wrong, that's another thing to help you understand. When you're answering questions and you're practicing, you need to understand why you got the question wrong. That builds on top of your learning as well. And I took my first test and I thought I failed. It timed me out. People were on question 51 because the teacher had to address that question. I was on question 34. And I'm looking at the time, I got a half an hour. I'm on question 40 something. When I got to question 60 something, I was 5 minutes. 5 minutes before this test was going to shut down. I got 20 something more questions to answer. I guessed from 61 all the way to 80. And let me tell you something. I skimmed through the question, picked out words was just popping out at me, and I answered questions based on that. I got many of them right. The math questions, the math questions, I couldn't even work through the math questions. The way I picked them, if the number was too low, the number was too high, did not choose that one. I chose the middle number. For some reason that worked. Let me tell you something. I prayed each question. I'm like, Jesus, please, with every question. Because I'm like, this is a difficult test. And I don't know why I studied. Like with nursing school, I'm telling you, you are not in the clear. You are in danger until you walk down that aisle and get your diploma. Every semester is different. You can kill one semester and kill it and knock it out the box. And the next semester, you are not doing so great. So that's why you have to always remain humble. Don't be all jumping up and happy and throwing it in people's faces, because this may be your semester, next semester may not be your semester, and you're gonna need help. So I'm looking at these questions, I'm like, okay, I gotta guess. So I'm guessing, and let me tell you something. Jesus was like, you know what? I'm here. You need to step back and let me take this test for you, because I think that's what happened, because guess what I got on this test that I thought I failed. When it shut me down, I handed in my scrap paper. Tears was forming in the eyes. Random person standing outside. I hugged the random person. I couldn't see because I understand why there's suicide watch on exam days and finals and things like that. I felt the way I was feeling. And then I'm like, you know what? I failed this test. And then when I was on question 34, I'm like, I got to go now and make an appointment with the teacher, because I just knew I failed this test. I said, I'm not going to pass this test. When I came back to do the, I forget what they call it, but you got to go back and look at the test. They give you 10 minutes to look at the test and see what you got wrong in your grade. You get your grade right there, but it shut me down. Right? It just shut off, so I couldn't even see my grade. When I sat down and I opened up my test, I saw a 68 out of 75. That puts me at a 90. Now, the question is, it's 80 questions. They didn't count the select all that apply. So that put me, when you do the math, at an 85. I got every select all that apply wrong. That put me at an 85 when you add the 80 questions. And I am still... I just don't believe how I passed this test. So that was Jesus. I'm telling you, he wants me to be nervous, because I thought I failed. So I studied, and the questions that were very difficult, what helped me the most was because they allow us to record the lectures. I listened to the recordings. I heard in my ear what the teacher was saying, and I'm looking, like when it was when the newborn baby comes out, and it was a question. I mean, it was a long option answer. Everything was short. These are the reasons why the baby is having certain breathing problems. What is normal when they come out? And they was given the definitions of why certain things, and there was one about the pH and the acid base, and I'm like, the teacher kept saying acidosis, but here is saying alkalosis. This has to be the wrong answer, so which was the right answer, because this is not normal. This is wrong. And that's why I chose certain answers based on what I heard and what was glaring out at me because of what I was studying and the notes that I was taking. Even though some of the words and the definitions was something that I really didn't recognize, there were certain things that were sticking out at me, and I chose those answers. And though when I did it that way, I got them right. And I have a process where I can rule out answers. And our teacher gave us a test-taking strategy because she is one of the instructors to prepare prepare people for the NCLEX. She works for those NCLEX preparation, and she gave us that, and I went through it, and I put it to practice. And also I learned how to answer questions, because I learned how to answer questions and learn how to rule out things, and I understood rationales for different things. It kind of helped me to pick between two answers and then pick the best answer. Now, when I was trying to pick that best answer, I'm telling you, I guessed 90% of the time. I guessed what that answer was, and that guess was correct. And let me show you something, the way I guess, because I've been practicing these questions, I know not to trust myself. This is I hope this makes sense to you. I trust my back brain. There's a back brain there that has information in my back brain that is stored. I don't trust myself. When I say in my mind that I think it's this answer, if it's between two answers and I say I think it's this answer, I won't choose that answer because I'm trusting myself. I'm going to go with the other answer, which is my back brain answer that has some hidden information that is hidden from me, my rationale and my own thinking. I choose that answer, and 99% of the time it is correct. I don't trust myself. I trust my back brain. So I hope you understand what I'm saying. As you go through questions, you are going to find out, you're like, oh, I knew it was that one. Oh, that was it. I knew I should have chose that one. That's your back brain. Learn your back brain, because that is the one. That's what's going to get you that right answer. Do not trust yourself. So if you're getting ready to click on the answer, trusting yourself, you better go with that other answer. You switch it up and you use that other answer, because 9 times out of 10, that's the correct answer. Do not trust yourself. I hope you understand what I'm saying. When you do questions, you will definitely understand what I am talking about. And if you understand what I'm talking about, and please, I don't want to feel like I'm crazy, please make a comment and say, I know exactly what you're talking about, because there is a back brain that knows information that you don't know. Trust that. And I'm telling you, that is what helped me. I call him Jesus. You can call him whatever you want. God helped me on that. I trust that. Trust your back brain. So that is how I am successful on my test. I practice questions, I study, and that's all you can do, right? But there's certain techniques that can ensure that your success will be greater, and those are the techniques that has helped me. Trusting my back brain, taking my own notes, listening to the lectures over and over again, going back over the information, asking. There's another one that I do. I ask questions in my notes, like, why is the GFR so important, or why is this specific symptom important to this disease process? Is this specific to the disease process? And then why are these signs and symptoms happening? Why is it affecting this particular body system? Once you know the why of things, it will help you so much. Don't just swing by and try to study the information and regurgitate the answer. You will always fail or not answer questions properly if you don't have a thorough working understanding and a working knowledge. And a working understanding and a working knowledge is what's going to help you apply that information to your exam questions, to the case studies and the scenarios, so that you can get the question right. So that is what's been helping me. If I were to work out those math problems, I think it was 5 math problems at the end, I got like 3 of them wrong by guessing. If I would have worked those math problems out, I probably would have got those answers right. I spent a lot of time staring at questions because they're very tricky. And what I have to do, so I won't time out, is not spend a lot of time on the question. I don't want to get anything wrong, but I know that's, not realistic, but I was spending too much time on certain questions and I timed myself out. If I would have had more time, I probably would have been able to answer those last 20 questions correctly. I'm happy with my 85. Very happy. I don't understand I don't understand how that happened. I mean, I understand Jesus took it for me. No, but I applied those concepts and those little tips and tricks while my heart was beating fast. While I was in my mind rationalizing when I'm going to make this appointment to my teacher so that we can go and have the conversation, because if you fail a test, you have to go to the teacher, make an appointment, and sit down, discuss why you got questions wrong, why are you failing, why you're not doing good. They recommend this and that and the other, and then you go on, you have to sign a piece of paper saying that you were, where am I going? Saying that you saw the teacher and all of that. So I just thought I was going to be in that office. So I started applying those techniques. I should not park here because it broke my window shield last time. These things that jumped down off the tree came back. My window shield was cracked. So yes, I applied them and it worked. And I hope these tips and tricks help you so that you can be successful on your nursing exams. Apart from studying, it takes more than just studying the information. You have to apply certain techniques and tips and tricks and all of that. Is a way to answer. It's strategic. And if you understand how to apply these strategic critical thinking techniques, you'll be able to find that right answer most of the time. Not even most of the time, the majority of the time, and go on and pass your test. So I hope this helped you. It helps me. It's been helping me since last semester. When I failed the med-surg, I came back last semester, took it again. I got an A. I am determined to get an A also in this class. Not that the A matters, because it doesn't really matter, but I am setting myself up. It's important in your first exam to set yourself up for success so that you don't have to work so hard in the other exams. Not that you're not going to work hard and you're not going to study, but you don't have that impending doom that I have to get a 100% on the next couple of exams so that I can make it through and progress on in the program. You don't want that. That's a lot of stress, unnecessary stress, and I don't wish that on anybody. So this is what's helped me. I hope it helps you, and I'll talk to you guys later. Bye. If you have any questions, please leave them in the comment section. If you have any advice for other nursing students, please leave it in the comment section so that we can all help and share, so that we can all press through and go on and just be successful at what we do, because this is truly our calling. If it is your calling, it's something that you want, it's something that you have to do, and you know that this is what you need to do, go on and do it. Be successful and take from each other, from this channel, from whoever you are getting advice from, and apply it to your life so that you can be successful in what you do. So I'll talk to you guys later. Bye.